This is Dr. Michael Tapper reporting on behalf of Infectious Disease Advisor from the National Meeting of the Infectious Disease Society of America, known as IDWeek, which is ongoing at the moment in New Orleans, Louisiana. And I'm very happy to have the opportunity to speak this afternoon with Dr. Allison Agwu from the Johns Hopkins University School of Medicine in Baltimore. And she has presented some very interesting data at this meeting on some of the issues about HIV disease in men of color. And I wonder if you could talk us quickly about some of the issues that came up in your study.
Yeah, so I was asked to speak in the key populations symposium about young men of color, particularly young men of color. And predominantly, as you know, there are major disparities in terms of the epidemic, and the proportion of the epidemic is represented by young men of color. And we're talking about disproportionate rates of 54% of those being infected compared to 15% of the population, so huge numbers. And the goal, overarching goal of the presentation was to talk about what the challenges are, but really to talk about how we can improve care and management for this population. What's needed for clinical research, what's needed for care, what's needed to actually move the needle in terms of outcomes, to decrease the number of diagnoses as well as to improve outcomes in terms of adherence and virologic suppression. So some of my data, as well as data from colleagues around the country, is what I used to come up with the presentation. I think one of the things that I tried to highlight in my 20 minutes or less was really how we have to be thinking beyond just the act. And one, we have to be willing to talk about the act, right? So, intercourse, condomless intercourse. We as providers and as a community have to be comfortable actually saying the words, because our discomfort actually is stigmatizing to our youth. But when we think about what we need to do for prevention, what we need to do for management, we have to not just think about the medical, but it's really a multi-level systemic issue we have that has everything to do with the individual, the community, the nation, the historical perspective, and all the things that have sort of led us to the point where we have disparities in health and multiple disease entities beyond HIV, and how this is really a symptom of everything else and not just, receptive anal intercourse without a condom.
But there are also some issues that have been talked about over the years in young black men, about men on the down low, about certain other groups, transgendered people, which have a group that's been receiving increasing attention, as the transgender community has also come out quite a bit in recent years. And then some community issues about the role of black churches, about condemnation in the black community, about gay behavior as well as bisexual and transgender behavior. Did you touch on any of those things?
So in my talk I didn't, because I didn't talk about transgender, because there was a whole session actually that was right before mine on transgender. And I think when we look at transgender, there are certainly within the transgender community disproportionate rates of HIV among black transgenders. So I think the talks overlap in a way when you talk about the sort of multi-level things. I think the down low is such an interesting term, and it's not one that I use too often, because I think it's oftentimes associated with black men who have sex with men and women. There are men of all races who have sex with men and women, and it's not called down low in those communities. And actually, it's actually a small proportion of black men who have sex with men who are also having sex with men and women. So I think when we focus on that, we also almost stigmatize it in a way. So I think some men do it in all communities, and it's not specific to black men, and let's move beyond that, and let's talk about what we can do to improve disparities in the population. So that's why I tend not to ever use the term, because I think it's one that was very sensationalized, and I don't know how accurate that terminology is, and so I don't ascribe to it necessarily. Your other comment about the black church, I think the black church is part of the overarching, I think, picture or a problem, I think, and not to say the black church is a problem, don't quote me the black church is a problem. I think culturally in the black community, we have a lot of issues in terms of masculinity and femininity, and if you're a man, you have to be a certain way, and there's no real room in the middle to just be who you are, and a guy who happens to like men. And so it's very stigmatizing to actually come out and say, I actually like men, and so it almost forces young people to go sort of underground. Where I think the black church, and I've talked to many individuals from the black church leadership, where I think their role is important, is that the Black church is a critical institution for the Black community.
And particularly for the older Black community
Particularly
as well.
for the older Black community.
Yeah.
And it's a critical institution. And I think how the Black church deals with sexuality and HIV actually can move the community forward dealing with HIV.
And vice versa.
And vice versa.
And the community has to work to move the
Exactly.
Black churches
Exactly.
forward. Black churches have to move forward as well.
Yeah. I think it's integrated.
It's a fascinating topic. Lots more educational work
Absolutely.
to do. Lots more community-based interventions.
Absolutely.
So we can't just intervene at the individual level. We really have to intervene at the community level and create an infrastructure that encourages people to be tested, to be on therapy, and supports them when they're on therapy without stigmatization. Thank you so much.
No, you're welcome.
It's a great topic.
Thank you for having me.
I spend a lot of time thinking about and working on, both in this country and outside the U.S.
Absolutely. Thank you for having me.
Thank you.